Hello everyone, did you know the contribution of copper sulfate in medicine? Let's explore more with us. First and foremost, what is copper sulfate? So, copper sulfate has been used since the late 1800s to prevent or treat several systemic diseases, including typhoid fever, cholera, dysentery, malaria, tetanus, and poliomyelitis. The compound is also used as a copper supplement for patients under TPN or total parental nutrition. It is interesting, right? So now we move on to the properties of copper sulfate. So the color of the powder is blue. The melting point for the copper sulfate are 110 degrees Celsius and 560 degrees Celsius if it is pentahydrate. The density of copper sulfate is 2.286 gram per centimeter cube.
We have looked at their properties, so we move on to the next context, which is the example of medicine that contains copper sulfate. One of the medicine that contains copper sulfate is Trelomin. Trelomin is the first and only FDA-approved multi-trace element injection for pediatric patients weighing at least 10 kg. It is used as source of zinc, copper, manganese, and selenium for parenteral nutrition when oral or enteral nutrition is not possible, insufficient, or contraindicated. Maltose is used for newborn infants who are ill or require special medical care due to prematurity, low birth weight, intrauterine growth restriction, congenital malformation, birth defects, sepsis, pulmonary hypoplasia, or birth asphyxia. What are the importance of copper sulfate in medicine? As we all know, copper sulfate have lots of advantages for consumer. One of it is as an active for drugs and medicines. Other than that, it also acts as a stabilizing agent in pharmaceuticals such as antacids and cough syrups. CuSO4 also helps in eliminating the spread and contagious diseases on athletes' food. Apart from that, it inhibits bacterial growth such as E. coli. And lastly, CuSO4 can be used as a moluscicide to eliminate a parasite related to the bilharzia disease. So we move on to the next part. As for the disadvantages of copper sulfate, it may cause severe eye irritation or you may have a nausea or vomiting. If we consume it in a large quantity, it will be very dangerous to our body as it can damage our body tissues, blood cells, liver, and even kidneys. If someone is extremely exposed to CuSO4, it may cause shock and death.
Breaking news, a 22-year-old unmarried male painter was found by neighboring shopkeepers to be rolling on the ground inside his shop due to severe abdominal pain. The man had tried to commit suicide by intravenously injecting a solution of copper sulfate, which is used as an antifolding agent in pains. He was taken to the local hospital with severe epigastric pain, vomiting, and diarrhea. His condition worsened after 3 days and he was transferred to the All India Institute of Medical Sciences, New Delhi. However, the victim died on his way to the hospital. His relatives and neighbors confirmed that he had recently been suffering from depression. That is all for the breaking news. That is all from our group. Thank you.